Hi, I'm Dr. Gammons. In this video I will describe patients that may not be appropriate for treatment of opiate addiction with buprenorphine. So we established in the prior video that it's very important to be comfortable with the idea that there is a physical dependence to opiates in place such that one cannot do normal activities of daily living without medicating an opiate withdrawal with an opiate of some sort. So I've said something along the lines of individuals that are using recreationally or that are not physically dependent may not be appropriate for this drug, and I believe that is accurate. There is some debate with that in patients with significant comorbidity, risk for overdose, or other bad outcomes. You could debate this. However, because buprenorphine is in fact an opiate and is not a benign drug, I believe that the diagnosis of opiate dependence, and particularly tolerance and physical dependence, should be in place to be an appropriate candidate for this drug. Because if there is not already a physical dependence upon opiates in place, and if I as a provider prescribe buprenorphine to this individual, I will likely be creating a physical dependence upon opiates in the form of buprenorphine. And this is a fairly serious situation. To be physically dependent upon opiates is a very serious and complicated situation. It's something that creates dramatic changes in an individual's life, and I think it should be taken very seriously, and it's a very serious situation, and there's consequences to physical dependence upon opiates. So while there may be some exceptions, and this may be debated by some addiction medicine specialists, I believe that the majority of patients that are candidates for buprenorphine clearly should be physically dependent upon opiates. If there's still a recreational component and patients are using because they're enjoying themselves and it's a recreational thing, and they desire treatment of their opiate addiction, I believe this should be approached from a behavioral standpoint, from a psychosocial support standpoint. You know, what changes in the individual's life need to be made such that they can create barriers between themselves and the recreational use of opiates. So medication-assisted treatment in that situation would be controversial, and in my opinion, it would be with trepidation that I would approach it from that standpoint. So I hope this is helpful, and we'll talk a little bit more in the next video about behavioral change. Thank you for watching.